As Colorado looks to rebound from the virus, it now faces a mental health crisis exacerbated by months of relative isolation.
It's a crisis that can cost lives. Almost 1,500 Coloradans died of an overdose last year. And numerous studies show a clear link between drug abuse and depression or anxiety.
One Colorado doctor saw the problem and created a program he believes will save lives. Denver 7's Molly Hendrickson explains.
The mental health crisis got worse during the pandemic.
I've seen a lot more people who are trying to chemically cope with anxiety, with the despair, with the stressors brought on by COVID. We know that there's 30% increase in overdoses across Colorado in the last year.
Dr. Stater is trying to do something about opioid abuse. He is the chair of the Colorado Naloxone Project.
So this is the kit.
Naloxone is given to people when they're in the middle of an overdose. It often saves lives.
And within the kit, there's instructions for use. So as soon as that's opened, whoever's with the patient, if they're found unconscious, they can open this kit.
The Colorado Naloxone Project is pushing to make sure naloxone is given to high-risk patients at every emergency room in the state, something that's never been done anywhere else in the country. Health One, SCL Health, Centura Health, and Denver Health are all on board.
We did find that the prescription fill rates were just not very good.
Holly Monette is the director of clinical pharmacy at Health One, which recently expanded its partnership with the Colorado Naloxone Project.
We felt that, patients really appreciated being cared about in this way, and we ended up deciding to put it across the whole market around January of 2021.
Dr. Stater says the Colorado Naloxone Project is just one step.
This is a part of a much bigger strategy. And what naloxone does is it helps us save lives today. But then the other piece of this is needing to expand treatment and give buprenorphine and medication for addiction treatment to a lot more patients who are struggling with opioid use disorders.
I'm Molly Hendrickson, Denver 7.